everybody. It's Dr. Brown with Canis Chiropractic, 2 offices located outside the Baltimore area, one in Eldersburg and one in Owings Mills. Today we're in our Owings Mills office. Had a great night last night. Awesome. I'm a little tired this morning, but the Capitals won the Stanley Cup. First time in 44 years. Been waiting this for a long time. So Alex Ovechkin hoist that cup above his head. The girl that's holding this camera is very, very disappointed though, because she's a Rangers fan. Ooh. But she is a little bit happy for me, so that's good. Anyway, we're here with Larry. Larry, tell him what's going on with you.
I was lifting something about 8 years ago, which then caused a bulging disc between L4 and L5, and terrible pain, and very limited motion for what I could do with my life. It was affecting work, recreational, couldn't go to the gym, and then came to see Dr. Brown, and I guess he can fill you in on where I'm at now, but I am back in the gym, full mobility, and have been maintaining for a couple of years now that I've been seeing Dr. Brown. And over the years with several MRIs, there has been no increase to the damage to my disc from the weekly maintenance that I do here with Dr. Brown.
Meaning that the chiropractic and the treatment that we're doing to him has kept that disc apart, has kept that bulge where it should be to keep him pain-free. So this is what we're going to do. The way we've been treating Larry is we've been stretching him out. We do what's called a flexion distraction adjustment, which I showed you in some other videos. And what that does is that pulls Larry apart to keep the pressure off of the back of the discs. And then what we do is we mobilize Larry's hips and pelvis using a manual adjustment. I want to show you guys a couple things so everybody understands in layman's terms about the disc. Anna, come here. Let me show you this picture here. So this is a picture of the spine. This is the low back in here. This is the bones from the low back. 1, 2, 3, 4, and 5. Sitting in between the bones are what's called discs. Discs are your shock absorbers. They keep it so your bones don't rub on top of one another. The discs live because of motion. Let me show you this. Anna, show this picture over here. Okay. The rest of your body, let's say somebody strains a muscle. You strain the mid-back or you strain the neck muscle. Usually heals pretty well, usually heals pretty quickly because it has a good blood supply. It's nice and red. It's a muscle. If you take a look at this is kind of taking you apart. You see here's the disc. In here are the discs, and they're white. When something is white, it does not have a good blood supply. So you think, well, you just told me in order for something to live and something to be healthy, it's got to have a good blood supply. When you have a good blood supply, nutrients are taken to the area, waste products are eliminated. The deep structures of your spine, the discs, have a very, very poor blood supply. That's why they don't heal well on their own. That's why when somebody irritates their disc, a lot of times they need therapy to help get that better. So, doesn't have a good blood supply. So how does a disc live? The disc lives because of motion. When your joints pump back and forth, the disc pumps, nutrients come to the area, waste products are eliminated. When somebody has muscle spasms, when somebody has a disc bulge, when somebody has problems in the low back, the back doesn't function the way that it should, you lose that mobility and the disc starts to break down. So what we do in this office to treat somebody that has a disc problem, we stretch that apart, we pull that apart so your body can bring nutrients to the area, take the pressure off of there, and make somebody feel better. So, in real simple terms, if you want to understand, when somebody has a disc problem, what's happening is everything's being squashed together. You got the bones, the disc is being squashed. So what's our goal here? Our goal here is to unsquash it. The way we're going to unsquash it is by pulling him apart. So let me show you how we do this. Larry, lay on your stomach. This is called a flexion distraction table. And this is a decompression type of table which will take the pressure off of his low back. And we'll check Larry's leg length, and usually he's a little short on this right side. And I don't know if you can see this on the camera or not, but short on this right side, and that's coming because of the pelvis is off kilter on Larry, and it usually is off. And when it's off on somebody, it's usually going to be off on the same side unless there's some sort of trauma to change that. So what's happened is this pelvis is shifted up on this side, the other side's riding down, torques the sacrum, so we'll adjust that. But the first thing we're going to do is we're going to take care of his disc. So what this table is going to do, I strap Larry in, He holds his hands up on the top of the table, and this is gonna pull him apart. I'm gonna open up this table, and you can watch the table separate here, and that's gonna separate the low back. Remember, it's being squashed. We wanna unseparate everything. So watch this. Table filling up with air if it's a little loud, but that pulls him apart. The next thing we're gonna do is we're gonna take this table into flexion, which is gonna open up that joint. Everything's being squashed. We wanna pull it apart and then open it up. And that's gonna allow that disc to fill up with fluid, and it's gonna allow that disc to reduce the pressure on the disc. So let's do this. And what we're doing, now Larry's, when he first came in, we really concentrated on this L4, L5 area because that's where the disc bulge was. So that's where we really worked. Now we're just trying to keep mobility into every one of these joints to make sure they're all separated. So we start at this top joint, which is around L1, and we're gonna stretch this out. And this feels very good. It feels very relieving. Larry, what's it feel like?
It takes the pressure off immediately.
Takes the pressure off because even though he's been feeling good, you cannot fully heal the disc. What we try to do is you try to maintain it. We're trying to maintain it so the pressure stays off. When somebody has a disc bulge, it's not really a cure as much as it is control. So we control this by pulling it apart. Larry has exercises that he does at home. He goes to the gym. He does things to strengthen his back. And those are the things that we do so somebody doesn't need to be in this office 3 times a week for the rest of their life. We want them to do as much as they can on their own to keep the pressure off of there. But what's really cool is Larry did have a recent MRI, and like he said, there was no further degeneration over the last few years that we've been treating him, which is great. So that's showing us, do you feel that pop?
Oh yeah.
That was good. That just popped. That separated that disc. That was great. That separated the joint. So it's showing that the chiropractic has been keeping that joint healthy, and it's not allowing it to deteriorate anymore. And that's what the research shows, that chiropractic has been proven to slow down the degenerative process. But by keeping the joint mobile, by keeping things open, it's going to slow down that process. So hopefully things don't break down as quickly. Feels real good, right, Larry?
It's unbelievable how it pulls it apart.
Feels very good. And I hear that a lot. People come in here and they say, God, Doc, I just wish I could just be stretched apart. That's what it feels like. It feels like my back just needs to be pulled apart. And we can evaluate them and we can see, and a lot of times we wind up stretching them out. It's also good for the other tissues in the back, not just disc problems, somebody that has compression. And we see that a lot these days. People have a lot of compression from doing the same repetitive thing over and over, from sitting all day. Larry sits a lot. He weight lifts a lot. Right, Larry? Is that why you're so muscular?
Yeah. Well, it's not from sitting.
So, you know, all these things are compressive on the spine, but this feels really, really relieving for him to take the pressure off of there. And then what we're going to do is we're going to adjust his upper back, because his upper back does get tight, and that tends to happen. When somebody has a problem in their low back, the pelvis compensates, the upper back compensates, and they work harder to try to keep the mobility that you lose in another area. But I do feel everything opening up, which is great, and that's why he's pretty much been pain-free. He does come in each week to maintain that, just because it does make him feel good. Good, right, Larry?
Oh yeah.
Feels great to pull it apart. Feels very, very relieving. So what I'm going to do now is I'm going to adjust Larry's mid-back, and then we're going to address his pelvis. Okay. So let's do this. Stay just like that, Larry. Let me adjust your mid-back. Well, let's see what it feels like. And he's always got some tightness in this area. You can feel these. You can see the way I'm rolling over these knots. Where it's tight, where the joint gets fixated, we want to get some mobility in here. So we're going to adjust this mid-thoracic area. Larry, take a deep breath in. Blow it all the way out. Just kind of relax. Good. And that was really good release in that area. So that's going to make him feel a lot better. Now what we're going to do is we're going to adjust that pelvic issue that we saw with the leg length. Larry, face me this way first.
Lower leg straight.
Lower leg straight. Okay, Anna, get real close to this so we can grab the elbows, kind of lay on your back. And we're gonna adjust down on this pelvis. Riding up on this side, going down on this side. We wanna straighten this out and put that sacrum back into the center. Just relax.
Ugh.
Wow, that was great. That was a great release. That's gonna make him feel so much better. It's gonna keep that mobility in there so he can continue to lift. Get these biceps nice and big. Okay, come toward me. All right. So we're gonna do the same thing. On this side, pelvis was riding up. We're gonna try to shift this thing down so that will level everything out. Just kind of relax here.
Ugh.
Great. That was a great adjustment. Good.
Instant relief.
Feels really good for Larry. So we might do a follow-up video with Larry. Want to tell him anything? Feel good?
Honestly, without coming here on Fridays and having this done, I would not be able to do what I have to do in my life for work and for recreational. I wasn't able to coach soccer. I wasn't able to go to the gym. I wasn't able to sit in my office chair for the extended hours that I have to. And coming here every Friday, which might seem like a lot, but it allows me to do all of those things in my life. And by Tuesday, I'm looking forward to my Friday visit at Dr. Brown's.
All right, well, that's good. I appreciate everybody watching. That was a great adjustment of Larry. He'll start to feel a lot better as the day goes on. And we will see you all next week. Please go to my YouTube channel and click the subscribe button. Thanks and have a great weekend.